Hello and welcome to the YouTube channel Health You, the place where my mission is to motivate you to look at the brighter side of the health. I am your host physiotherapist Meghana, and in today's video I'm going to talk about one more options of management of synkinesis that happens due to Bell's palsy, and that is mime therapy or else meme therapy. What exactly it is, how it was started, what are the benefits, and what can be expected, what is the output of it, and how long does this treatment take to see any recovery, and how effective this is. These are certain points that I'm going to discuss in today's video. So if you are interested in knowing about mime therapy, make sure to watch this video till the end. So basically, mime is a format of performance art which uses facial expression as a tool to communicate the story without using any words. A simple example of mime art format could be a very famous artist named Charlie Chaplin. Have you ever seen a Charlie Chaplin series? He never uses any word. It's all his expressions of the face that tells the story. And mime corpuscle uses the same principle. Now, in 1975, Department of Facial Research at Wilhelmina Estes in Amsterdam, they came up with a film which was titled Peripheral Facial Palsy. And in this film, a gentleman named Jan Bonk illustrated the functions of mimetic muscles by showing the work of different facial muscles and how this expressions of facial muscles changes the entire story or else can communicate and complete story with the help of only expressions and without any use of single oral word. Now later on, this gentleman Jan Bonk along with Deb did more work on using the mime art form into the management of facial palsy. And that's how they started working together. They did a lot of research on this and they came up with this format of exercise therapy called as mime therapy. And further on, they started delivering mime therapy to the patients of facial paralysis. Further, in 1997, they started training other physiotherapists in the format of mime therapy, and that's how mime therapy was available in Netherlands for the management of Bell's palsy. After the death of Jan Bonk, 3 physiotherapists continued working on mime therapy and they also continued preaching mime therapy. Till date, there are very few but very strong research articles that has been studied and are present stating the effectiveness of mime therapy. But unfortunately, this particular format of therapy was not professionally taught to many physiotherapists across the globe, and that's the reason this format of therapy stays unknown to a lot of therapists across. But the randomized control trial studies that have been done shows a good amount of positive result with the help of this therapy format. So what does this mime therapy exactly comprise of? Now the principle of mime therapy, or as the basis on which the mime therapy program is designed, is first breathing. According to mime therapy principles, breathing impairment can affect your facial expressions. Hence, if there is tension that's present in any part of the body, it will definitely affect the tension on the facial muscles, and thus the face will look more asymmetrical compared to the body who is more relaxed. The second principle of mime therapy is articulation. According to mime therapy, the facial muscles have got a lot of expressive possibilities. Different level, different degree of facial movement, at what intensity it is performed, at what speed it is performed, determine how the entire facial expression changes accordingly. Let me give you a small example of this. Whenever we try to pull down the mouth corner down in a very fast way, the expression is different compared to when we are pulling the corners of the mouth downwards in a gentle manner. Just see the difference. When I was doing fast, my face looked more scared or anxious. But at the same time, if I am doing the same movement gradually, then my face looks a little bit more sad. So, same movement but different expression has been created by changing the frequency and the intensity of the muscle contraction. So that's the basis of mime therapy as well. The third principle of mime therapy is alertness and awareness of direction of movement. Now, in my previous videos also, I've spoken about the properties of facial muscles. Facial muscles are very different from the normal musculature of our body. The facial muscles are small, they lack neurons or else neuroreceptors that tells the position of the muscle to the brain, and they don't have any tendons, which means they are directly attached to the bones of the face. This leads to an impairment or let's say inability of a person to understand which direction the movement has to happen. And that's why whenever Bell's palsy happens or else synkinesis happens, the patient voluntarily is not able to determine in which direction and at what force and what speed he or she needs to do the movement. And here is the role of mime therapy. Mime therapy teaches awareness as well as the direction of the movement of the facial muscles. And the fourth principle of mime therapy is to improve the communication skill of a patient. Now, just imagine when you have Bell's palsy or else in terms, say, synkinesis, the biggest trouble that you have is in socialization. You will always feel that you are not able to communicate that effectively as you were able to do it before. So the entire base of mime therapy or else the entire goal of mime therapy is to improve your horizon of your ability to communicate more effectively and more efficiently. And these four principles forms the basis on which the entire mime therapy treatment program is decided. Hence, in short, you can say the aim of mime therapy is to improve the symmetry of the face and at the same time reduce the synkinesis or else reduce the irritability or else hyperactivity of the synkinetic muscle or else overactive muscles. But now the question arises how it happens or else how it is done. There are certain steps that are followed in mime therapy. These steps forms the components of the therapy itself. What are these steps? Let's have a look. So the first step of mime therapy, that's the basis of the entire program, and that is increasing patient's education and awareness about his condition, about the problem or else the pathology behind this, as well as about the prognosis or else how much or to what extent the recovery can be expected following the episode of synkinesis. So you can say how much benefit a person can gain with the help of mime therapy. All this education is given first to the patient before even the patient starts with the therapy. After this, the second step of mime therapy or as the second component of mime therapy is self-massage of face. Yes, massage has been given a lot of importance, which I even believe is super important or is super essential in management of synkinesis, is because massage helps to reduce the tension in the overactive muscle, which is the biggest problem in synkinesis. So what is synkinesis? Synkinesis is nothing but a group of muscles which are overactive, hyperactive or hyperirritable. And these needs to be subsided or else needs to be calmed down, and that is only possible with the help of facial massage. Now this massage not only has to be done on one side of the face, but it has to be done throughout the face, and at the same time it has to be also done in the neck region. The reason being, the facial muscle, even though is only affected on one side, but this weakness leads to tightness in the opposite group of muscles as well. Hence, whenever the massage is done, the focus have to be equal in both the directions so that an equal symmetry can be achieved. After massage, the third point is breathing and relaxation exercise. As I said, in principles of mime therapy itself, breathing has been given a lot of importance. Breathing also reduces tension and increases awareness about one's body. And that's why breathing exercises and relaxation techniques help a person to reduce the tension, which also later on impacts the symmetry of the facial muscles. Fourth point, coordination exercises of the face. So basically, due to overactivity or else hyperactivity of certain group of muscle leads to lack of coordination of facial muscles, and that's why you see this asymmetry whenever a person is trying to do any kind of facial movement. Hence, the exercises whatever are given focuses first on developing the coordination, which means having the movement happening equally on both the sides, not only on the affected side but also on the non-affected side. So if the non-affected side is not able to elicit complete movement, then there is a focus that a mild movement happens, but happens equally on both sides of the face. So that thing is kept in mind when the mime therapy exercises are given to the patient. Fifth exercise is eye and lip closure exercise. Now, there's a biggest problem of synkinesis that whenever a person tries to smile, the eye closes, or is whenever a person blinks, the mouth moves. So there is this incoordination that is happening. So the training of mime therapy very much focuses on improving the individuality of the movement, which means with eye movement, there shouldn't be any mouth movement that should happen, and with mouth movement there shouldn't be any eye movement happen. And the exercises with mime therapy focuses on teaching that to the patient. After that, the next step is letter and word exercises. Definitely, synkinesis also affects a person's ability to speak and say, and that's why the training also includes teaching patient to pronounce letters and words in a way that is sounded well, but at the same time do not cause any kind of irritability, hyperexcitability, or synkinetic changes on the face. Seventh step is the expression exercise. Remember, I told you mime is about expressions. Expression used at different intensity, different degrees, and different level. And this mime therapy's last step is expression exercise, where the patient is taught to communicate through the expression by doing expression exercise at varied degree, varied intensity, and at varied time. So these 7 steps forms the basis, or else forms the complete therapy program through mime therapy. Now, how long this program lasts? Now, mime therapy is a long-term process. It takes more than 1 year to see some beneficial result. A patient might need 1 to 1.5 years of time to achieve benefits with the help of mime therapy. But these benefits are super practical and are self-dependent. So this is not about a complete treatment, but it's more about teaching patient the techniques, the strategies through which he can communicate more effectively and minimize the effect of synkinesis. Mostly the mime therapy sessions last for 45 minutes, which can be initially first for 10 days continuously, so that the patient learns all the 7 steps of exercises in a correct manner. After that, the sessions are mostly weekly or monthly based on the need or severity of symptoms of the patient. Along with that, home exercises or his home exercise program is given to the patient, which has to be changed after every assessment, so that patient practices the right format of exercise, keeping the goals in mind. But one thing that's super important about mime therapy is it is only effective, or else the mime therapy is only designed for synkinesis. It is not helpful at all in the management of people who is having acute facial paralysis where there is no synkinesis present. Mime therapy basically only focuses on synkinesis management. Hence, if you are someone who is suffering from synkinesis, definitely mime therapy would be helpful for you. But if you are having Bell's palsy that has been either acute or chronic, but you don't have any kind of synkinetic changes, then mime therapy might not be of your help. Now comes the prognosis, or else how much effectiveness one can achieve. Now, mostly mime therapy can give you somewhere around 60 to 75% of improvement in your synkinesis level, which is quite a good number, I would say. And this has been backed by some good research paper, which are randomized controlled trial. But unfortunately, these researches have not been taken further that often, and that's why a lot of awareness is still lacking about this therapy format. So it's very important that future generation of therapists work toward the research and finding out and making the mime therapy more effective, more efficient, and more accessible for people across the globe. I hope you found this video informative. My agenda through this video is just to educate you and let you know what are different formats, therapies, treatments that are available for Bell's palsy management or synkinesis management. I hope you are liking my content. If yes, make sure to like, share and subscribe to HealthQ channel. I'll see you in another video. Thank you.